Okay, let's go over this cabbage scenario. So a 78-year-old man has diffuse coronary artery disease in his left anterior descending, left circumflex artery, and the right coronary artery. He is prepared for a triple bypass surgery. So I know they're going to be bypassing 3 either veins or arteries. Of these 3 arteries, using a portion of the saphenous vein, so I know they're going to use a saphenous vein, and they're going to also use the left internal mammary artery. So a portion of the saphenous vein was harvested from the right femoral leg, and it was attached to the aorta and carried down to bypass 2 occlusions. So they used one saphenous vein for 2 different veins, one in the LAD and one in the LCX, as stated above in our description up here. So that comes out to 2 veins. Okay, so I have 2 veins. We then detach the lower half of the left internal mammary artery from the subclavian artery and carried it over to the occlusion of the RCA. So there I have 1 artery. So here's my triple bypass, 2 veins and 1 artery. And the pump was on during the entire procedure, so that pump oxygenator. So my codes would be 33533 for that coronary artery bypass using an arterial graft, a single. So using 1 single artery graft, which is my 1 artery here. Now an add-on code 33518 is also going to be coded for the coronary artery bypass using my vein graft and arterial graft, and for 2 vein grafts. It was times 2. So those are my 2 codes for this cabbage scenario. Now percutaneous transluminal coronary angioplasty is a non-surgical procedure that involves inserting a small balloon catheter into an artery or the growing and advances the catheter up into the coronary artery. The balloon is then enlarged in the artery. This is coded in the medicine section 92920 to 92921. Now your textbook has this incorrect, as it says 92982 to 92984, but these codes were deleted in 2013 and replaced with the 92920 to 92921. So it's just not updated in your textbook. Now if percutaneous transluminal balloon angioplasty was performed on an artery other than the coronary arteries or pulmonary arteries, then it would be coded in the surgical section 35471 to 35476. Now the lymphatic systems, I'll just touch on this. Just the lymph nodes, they're located in the back of your head, in your neck, the cervical region, the armpits, axillary region, your chest, supraclavicular region, abdomen, retroperitoneal region, or your inguinal region. Also the spleen, you can have a splenectomy, which is an excision, a rupture of a spleen where they do a splenophrachy, so they're repairing that spleen. Also a splenectomy can be laparoscopic. And then just some general bone marrow. You can have your red marrow, which produces red blood cells, white blood cells, and platelets. Your yellow marrow replaces red marrow with fatty tissue that does not produce blood cells. And then different procedures for bone marrow. You can harvest it, aspirate, biopsy, transplantation, preservation, preparation, and purification. Now we're going to test your knowledge and go through just a couple scenarios on the last part of this section.